Hello and welcome to Rochelle Martinez's presentation on personality and quality of life in elderly. Let's begin by discussing aging in the United States. The number of Americans ages 65 and older is projected to be more than double from 46 million as of 2016 to 98 million by 2060. Likely to rise from 15% to 24%. The average life expectancy in 1950 was 68 years. In 2013, it was 79 years. Older adults are working longer, and it is projected that this will continue to increase along the years as life expectancy increases. Poverty rate, however, has decreased by 20% since 1966. Let's discuss more some of the challenges the elderly population faces today. One of them is obesity rate growing in number by up to 40%. The next is demands for more nursing home and better elder care because of the growth in population. Before we go into personality development, let's discuss the Big Five model. Extroversion. It implies an energetic approach towards the social and material world and includes traits such as sociability, activity, assertiveness, and positive emotionality. Agreeableness. In contrast, prosocial and communal orientation towards others with antagonism and include traits such as altruism, tender-mindedness, trust, and modesty. Conscientiousness describes socially prescribed impulse control that facilitates task and goal-directed behavior such as thinking before acting, delaying gratification, following norms and rules. And then we have neuroticism, which is contrast, emotional stability, and even-temperedness with negative emotionality, such as feeling anxious, nervous, sad, and tense. Openness describes the depth, originality, and complexity of an individual mental and experimental life. Now, personality development in older adults. In older adults, personality development seems to only increase in agreeableness, conscientiousness, and emotional stability, while completely decrease in extroversion and openness. Extroverted, conscientiousness, or open behaviors may not be experienced in older adults unless they place themselves in stimulating situations, but when time is presented, you will find they will reflect increase in those behaviors. We will see maturational changes in traits starts to occur across the lifespan of individuals. Cantler et al. 2015 conducted a study that added an important extension to the maturity principle of personality development. As their study looked into the sources and patterns of personality development and the interrelation between personality traits and well-being in old age, there are specific adaptive mechanisms that play a role for older adults. Neuroticism increases as older people become aware of their losses in cognitive and physical functionality, as they become more aware and cautious with the potential dangers of life. You will also see a decrease in extroversion and agreeableness due to the selectiveness in activities and social relationship. Extroversion showed to be a clear factor for likelihood of experiencing positive effect and life satisfaction as people age. Shanahan et al. Also conducted a study to discuss the conscientiousness and how it can have direct effect on health outcomes throughout life course. In childhood, positive parenting like avoidance of health risks, stressors, and chronic diseases can lead to health and well-being that can continue to reflect into adulthood and even influence the beginning of an educational career. In adolescence, conscientiousness can promote better choices which can transition into adulthood and leave lifelong implications for health through educational attainment, family life, and stressor in the workplace. Conscientiousness in adulthood leads to better implication of health. However, as maintenance of health becomes increasingly challenging as individual age, it becomes consequential to overall health. Now let's discuss quality of life in older age. Personality dimensions play a key role in the subjective perception of the quality of life in old age. Weber et al. Cited in their article that there are 4 factors that can influence the impact on the individual perception of the quality of life. These are social characteristics, presence of depression, current health variables such as comorbid physical illnesses, and long-term individual characteristics such as the 5 personality dimensions. Individuals with poor health are likely to participate in activities, which lead to decreased interactions and overall quality of life. Personality traits can influence the way people cope with situations at life, which then interplay with the quality of life. Notavelli and Blaine discussed quality of life can be harder to measure in those with cognitive impairments, as they may lose the sense of what quality of life should be. Quality of life can also decline within depression in old age, as social disruptions such as social isolation, physical disability, and cognitive decline can all contribute to depression. Let's discuss some of the ways empowerment care can help with increasing quality of life in the elderly. It is important for the elderly to seek physical care as it is one of the factors that can determine quality of life. To it all, perform a study that found that elderly patients in nursing home lacked in quality of life, and that meant there was a gap between the residents' need and the care provided by the health professional. The key to empowerment care is to make the elderly feel valued. Nurses can provide empowerment care by providing patients with information about their health and involving residents in the health care plan. Allowing the elderly to perform the most activities on their own also increases independence and adds to this empowerment care. Nurses who are sensitive to the needs of elderly residents can provide them with overall better care as well. Haltolder and Gustav Tertier also conducted a study in a nursing home that provided the characteristic perceived by the elderly people living there to increase understanding on quality of life in elderly. Safety concern was one of the main concerns for the elderly. Elderly wanted to feel safe while in the nursing home, but also wanted good, dependable, and individualized care. They were concerned with having rehabilitation services that would maintain their health and physical ability. Further, for an individual who newly moves to a nursing home, seeing the conditions of others can affect their perception of quality of life. This may require for demented residents to be separated into another ward where their needs can be met so that cognitively intact residents can enjoy the remainder of their life without possible impact on their perception of the environment. Study also mentioned that having a good relationship with one's family along with spending time with them is also a large factor in quality of life for the elderly. Having use of telephone to contact family is also of benefit. Purpose in life. Purpose in life is defined as a reason for living or feels that life has a purpose. Hobbies are a reinforcement that can keep an individual independently functioning. Tomioka et al. Conducted a study that found that not having hobbies nor purpose in life was associated with a significantly higher risk mortality, decline in activities of daily living, and decline in instrumental activities of daily living. They also found that benefits of having hobbies can be associated with slower rate of motor decline. It can increase physical activity and improve quality of life. Although there may be cognitive functioning impairments and depression in aging adults, this study suggests that having hobbies and purpose in life can extend longevity and healthy life expectancy among community-dwelling older adults. And this is very important due to the mortality rate that increases in older adults as they age in these populations. Conclusion. John et al. Showed us that personality psychology is a complement to biology, as it helps us understand diseases and lead to promotion of health and longevity. The elderly population has been growing in numbers. We learned that personality in elderly acts as a facilitator in successful aging. While conscientiousness remains stable throughout life course, neuroticism and openness tend to decrease the most in older ages. Social changes along with biological factors can result in depression and decline in quality of life, which can affect personality traits. Empowerment care can help increase quality of life through acts of independence and involvement in their treatment plans. Mortality rate in elderly can be reduced by enjoying hobbies and pursuing purpose in life. Further, the overall lifespan research has led us to understand how traits risk in early ages contribute to the study of individual differences and predictors of consequential outcomes. And this is the end. Thank you for joining me. These are the references to this slideshow. Bye bye.